Hello, my name is Brooke Vernon. The purpose of my presentation was to create awareness of heart disease in women through identifying risk factors, understanding signs and symptoms of a heart attack, as well as managing self-measured blood pressure. The population that I chose to utilize consisted of non-clinical female staff at Norton Heart Specialist. The topic was cardiovascular disease among women, which is the #1 killer of women. I chose to do a PowerPoint presentation and utilized a total of 16 slides for the presentation. I decided to go with cardiovascular disease among women actually after we completed the windshield survey in 451. And I determined that cardiovascular disease is indeed a real threat among women in the United States, and particularly found the increased risk in Jefferson County, which is a county in Louisville, Kentucky, and realized that education was needed regarding modifiable risk factors, one of those being hypertension, high blood pressure. Let's see. The total population of Jefferson County is 765,352, and of those, 51.7% are female. As far as the participants for my PowerPoint presentation, there were a total of 6, and again, they were all female. I found in the literature that there are common barriers that contribute to the prevalence of cardiovascular disease among women. Musich explained how enhancing health literacy may increase the number of women who receive care for heart disease prevention. Secondly, Segun emphasized the consideration of gender disparity in addressing heart disease. And he actually suggested that enhanced access to healthcare services would be very beneficial in addressing the threat of cardiovascular disease among women. Also, the American Heart Association, in collaboration with Go Red for Women, created an initiative to increase the women who realize heart disease is their #1 killer. And then with that, to take steps in prevention. In order to devise the project, I used the community guide, which, as we all know by now, is a resource tool composed of a collection of evidence-based findings to improve health in a community. One intervention that I used to help prevent cardiovascular disease in women was implementing self-measured blood pressure monitoring. The PowerPoint presentation, again, was composed of 2 slides which detailed the county health rankings and roadmaps with the focus on health behaviors, which again, as we know by now, account for 30% of impact on health, and actually just so happen to be modifiable risk factors for heart disease. In Jefferson County, 19% of the population are smokers, 32% are obese, and 26% are physically inactive. And a whopping 39% have been diagnosed with hypertension. The highlight, again, of the presentation was to educate women on the threat of heart disease, given the fact that it actually kills approximately 1 woman every minute, yet only 1 in 5 American women believe that heart disease is her greatest risk. Also, a goal was to educate on the risk factors, steps to take to prevent heart disease, signs and symptoms of a heart attack, as they are less recognizable than what men typically experience, and implementing self-measured blood pressure monitoring in hopes to empower them to take charge of their health and address other modifiable risk factors. At the conclusion of the presentation, my objectives, the audience would be able to identify modifiable and non-modifiable risk factors for heart disease, which was met by a higher score achieved on the post-questionnaire that I devised as compared to the pre-questionnaire that they took prior to the presentation. Objective number 2, explain the less recognizable signs and symptoms that women may experience with a heart attack. That was met by correct answers from the entire audience to a question on the pre and post questionnaire regarding differentiating signs and symptoms of a heart attack of women that women experience compared to men. And objective 3 was the audience would be able to discuss proper use of self-measurement blood pressure monitoring through demonstrating the proper use of a device. This goal was actually unmet because I ran into some problems with obtaining the blood pressure cuff. So even though that goal was unmet, with all of the literature that I provided in the instruction, they left feeling very comfortable in self-measured blood pressure monitoring and kind of what to look for in a blood pressure device, keeping a log, which I'll go into briefly here shortly. The handouts that I used a blood pressure measurement instructions on behalf of the American Heart Association. And it looks like this, very colorful, very, very nice, detailed instructions, and I'm not going to go over it with you all, but I do like that actually at the very bottom, it kind of condensed a couple things onto one page for them to take home. But it also has on here the American Heart Association recommended blood pressure levels, so which we really went over in depth, with that and kind of what to look for and knowing their numbers, their systolic blood pressure, their diastolic blood pressure. So that was one handout that I used. And then also the American Heart Association blood pressure log, which looks like this. They also, on their website, they have small wallet-sized cards that is just this kind of condensed into a carry card, which is really nice. But I like this log because at the top you can see it has just kind of a little overview of some tips to help them take their blood pressure, when to take it, and then they come down here and then they can log it. So they want to take this with them to their to follow up doctor's appointments as well, so they can have something to compare their measurements along with what they obtained at their primary care visit. And then the pre and post questionnaire was a 10-question true false. There were a couple multiple choice questions, which 5 out of 6 total participants actually scored at least a 10% higher score on the post questionnaire. So that was one of my the way that I gauged my objectives being met. So to conclude, cardiovascular disease is the #1 killer of women. There are modifiable and non-modifiable risk factors. We really want to focus on those modifiable risk factors because those are the risk factors that can be changed. So it's very important to create awareness utilizing changing those risk factors. Women experience less recognizable signs and symptoms of a heart attack than our male counterparts. And self-measured blood pressure monitoring can reduce the risk of heart disease. In reflecting on this experience in Nursing 452, I am completely appreciative of the organization throughout this course. The planning of the Prevention Plan project. If you would have told me that this would be the final product way back in 451 during our windshield survey, I would have said you were crazy. Every step of the process has taught me something new, whether it's a better way of assessing, a smarter way to plan interventions, or a better way to implement said interventions. All of these tools, I believe, will change my practice by making me a better nurse all around. Also, as far as population health, I have a stronger appreciation on how the health of an individual is only a small piece of the puzzle. It takes a magnifying glass to zoom in on the entire population in order to address health concerns and create positive outcomes.